Very good morning and welcome back to our online video class. In this session, I will be dealing with development of liver and biliary apparatus. We know that the primitive gut tube has three parts. One is the foregut, midgut and hindgut. From the lower limit of the foregut, at the junction between the foregut and midgut, there is a endodermal diverticulum appears. This diverticulum is known as hepatic bud or liver bud. Actually, this hepatic bud and liver bud, it grow cranially towards the septum transversum within the ventral mesentery. And this liver bud, like that, it grows cranially and divide into right and left branch towards the septum transversum. And we know that the septum upper aspect of the septum transversum, which forms the diaphragm, and the lower aspect of the septum transversum will form the fibroareolar stroma of the liver. Liver is a mixed gland because it has both exocrine function and the endocrine function. And we know that the structure of the gland is functional unit is the parenchyma and the surrounding fibroareolar stroma, that is the capsules. And the capsules of the liver is known as Glisson's capsule, so that the parenchyma of the liver is derived from the liver bud, endodermal liver bud and the fibroareolar stroma with connective tissue cells like the Kupffer cell is derived from the septum transversum. Here is the fibro liver. So, if it is liver and there is the fibroareolar stroma. So, this right and left branch of the liver bud, actually the cells of this right and left branch, actually they multiply and surround the right and left branch, and their size is almost symmetrically, they are equal, and these cells, when it multiply around the right and left branch, they forms a cluster of cells. This cluster of cell is known as hepatic cylinders. It is known as hepatic cylinders, and these hepatic cylinders on the right and left side, they are almost equal, so that physiologically the right and left lobe are equal in size, because the hepatic cylinders actually on the right and left side are both are same, so that the physiologically or functionally the right and left lobe of the liver are equal in size. But anatomically the right and left lobe of the liver are not same or are not equal in size. But this liver bud, when grow cranially, it enlarged very rapidly. But initially in the abdominal cavity, there is a very limited space for giving the space of liver within the limited abdominal cavity. The gut tube, that is the midgut, actually came out from the abdominal cavity, and when the abdominal cavity enlarged in size, then the gut tube or midgut again retract the abdominal cavity, and for this rapid enlargement of liver is responsible by one factor. Like we know that in fetal life or in fetal circulation, highly oxygenated blood, near about 80% saturated oxygenated blood actually comes from the mother to the fetus, first enter into the liver. So, liver first received the highly oxygenated blood, that is why liver actually enlarged very rapidly. Another important function of the liver is the hematopoietic function in fetal life. But after birth, this hematopoietic function is replaced by the spleen and also the bone marrow. But the hematopoietic function of the liver, actually this function, hematopoietic function is diminished during the last 2 months of pregnancy. But the diminished hematopoietic function firstly pronounced in the left lobe, then the right lobe of the liver. So that this diminished hematopoietic function is firstly pronounced in the left lobe, then the right lobe, so that anatomically the left lobe of the liver is smaller than the right lobe of the liver. And now this hepatic bud, it grow cranially towards the septum transversum, so that the parenchyma and the fibroareolar stroma, not parenchyma, the fibroareolar stroma with the connective tissue cell like Kupffer cells are derived from the septum transversum. And we know that we already discussed on development of the vascular system in the chapter of cardiovascular system. When the right and left vitelline vein actually when they passes through the liver, their architecture are disturbed due to the hepatic cylinders, and this loss of architecture of the right and left vitelline vein actually forms the hepatic sinusoids. So, the hepatic sinusoids of the liver are derived from the right and left vitelline vein. When they passes through the liver, their architecture are lost and by the hepatic cylinders. Now, these hepatic cylinders form the parenchyma of the liver and the fibroareolar capsule, and also the Kupffer cell, that is the connective tissue cells, are derived from septum transversum, and the hepatic sinusoids actually derived from the right and left vitelline vein. There is some ligaments of the liver. We know that the ligaments are the number 1 ligament. Look very carefully. We know that this is the ventral mesentery and this is the dorsal mesentery. Within the ventral mesentery, there is the liver bud appears, and when the liver actually enlarged very rapidly, when the liver enlarged very rapidly like that, it very rapidly, this ventral mesentery actually it connect the liver, stomach and to the stomach to the abdominal anterior abdominal wall. So, this ventral mesentery actually now forms the lesser omentum, like that is the lesser omentum, here is the lesser omentum, and the ventral mesentery which surrounds the liver, they form the 2 ligament of the liver. One is the coronary ligament, one is coronary ligament, and another one is the triangular ligament. So, this coronary and triangular ligament of the liver actually derived from the ventral mesentery, and also there is one important ligament. Look very carefully, the part of the ventral mesentery which connect the anterior surface of the liver to the ventral or anterior abdominal wall, it is formed a ligament, and this ligament is called the falciform ligament. So, also the falciform ligament is also derived from the ventral mesentery, and these 3 ligaments are a false ligament because they are the peritoneal fold, and there is 2 ligaments of the liver. These 2 ligaments are the ligamentum teres hepatis, ligamentum teres hepatis, and another one is the ligamentum venosum. And we know that in fetal circulation actually the left umbilical vein that carry the highly oxygenated blood from mother to the fetus, and we know that after birth that left umbilical vein become fibrosed and convert into a ligament. That ligament is called the ligamentum teres hepatis, and the highly oxygenated blood actually bypass within the liver, bypass the portal circulation within the liver, and it actually bypass through this highly oxygenated blood actually from mother to fetus, it directly goes into the inferior vena cava through a bypass channel. This bypass channel is, we know that it is known as ductus venosus, through the ductus venosus, and after birth that ductus venosus also become fibrosed and convert into a ligament. That ligament is called the ligamentum venosum. So, the ligamentum teres came, it is the remnant of the left umbilical vein, and the ligamentum venosum, it is the remnant of the ligament of the ductus venosus. So, come to the points. The liver parenchyma is derived from the liver bud, when this liver bud divided into right and left branch, and these the cells of the right and left branch actually they become multiply or differentiate around the right and left branch and forms a cluster of cells. This is known as hepatic cylinders, and these hepatic cylinders now form the parenchyma of the liver, and also the fibroareolar stroma, that is the capsule, Gleason's capsule, and connective tissue cells like the Kupffer cells are derived from the septum transversum, and the hepatic sinusoids are derived from the right and left vitelline vein. And the ligaments of the liver like the coronary ligament, triangular ligament, and the falciform ligament, actually these 3 ligaments are derived from the ventral mesogastrium or ventral mesentery, and the ligamentum teres hepatis actually is the remnant of left umbilical vein, and the ligamentum venosum, it is the remnant of the ductus venosus. At the same time, there is another bud appears proximal to the right and left branch of the hepatic bud. This is known as cystic bud. And now by the appearance of cystic bud, the hepatic bud now divide into two parts. One is called the pars hepatica, which this pars hepatica actually forms the liver, and this part is known as pars cystica. It is known as pars cystica, and this pars cystica actually forms the gallbladder and also from the cystic duct. And we know that that there is in adult life this cystic duct actually fused with the common hepatic duct and form the common bile duct. So the portion between the right and left branch of hepatic bud and the appearance of the pars cystica, only this portion will form the common hepatic duct, and the portion between the appearance of the pars cystica and the duodenum, only this portion will form the common bile duct. And now this right and left branch of the liver bud actually it divides into smaller and smaller branches, and these smaller branches ultimately form the intrahepatic part of the biliary apparatus. And last of all, there is a bud appears, it is known as ventral pancreatic bud, and cranial to the ventral there is a dorsal pancreatic bud. When the axial rotation of the second part of the duodenum occurs, the dorsal ventral pancreatic bud together with the bile duct actually it moves behind the second part of duodenum and come to lie very close to the dorsal pancreatic bud. Now its final position, the bile duct actually assumes its final position, and this bile duct actually fused with the main pancreatic duct and form hepatopancreatic ampulla or ampulla of Vater, that is guarded by sphincter of Oddi, and this hepatopancreatic ampulla now opens into the interior of the second part of the duodenum at the mesoduodenal papilla, which lies 8 to 10 centimeter distal to the pylorus. Now two important applied anatomy that is related with the development of liver and biliary apparatus. If any part of the biliary apparatus is absent, either intrahepatic part or the extrahepatic part of the biliary apparatus, if any part absent, then the condition is called the atresia of biliary apparatus. Or like this is the liver, if there is a tongue-like projection from the right lobe of the liver, then the condition is called the Rydell's lobe of the liver. So that is all about the development of liver and biliary apparatus. So thank you very much.